Portable 55, Airlift Comm Center. Portable 55, Airlift Comm Center. Launch tones for Portable 55. Dr. Michael Copass answered his final call on July 26, 2024. He was a visionary whose legacy will live on through the countless lives he saved, the air medical program he founded, and the world-class paramedic program he helped to create.
We all knew him, we all loved him, and at times we feared him. Heaven help the person who didn't figure out what Dr. Copass expected early and often. But we're here to honor and most importantly, to celebrate. I mean, we do this at this phase of our lives all too often, but it's a time to gather. It's time to gather and honor people and to see their life as it passes through their existence, not as on a single line in time, but as a sphere that rotates through, because there's so many different aspects to everyone's life. He was many things to many people: doctor, teacher, truly visionary leader and reformer of emergency medical systems, not only here in Seattle, but throughout the world. Every time when someone calls for help, I hear Dr. Copass say, when they call for help, you give them help. You don't give them shuck, you don't give them jive, you give them help. You don't give them another number to call, you call the number. The only correct answer for a call for help is sure. When in Southeast Alaska, I realized he was revered as the patron saint of the patients and docs in those communities that are isolated, where the only way out to a more involved level of care was by boat or by plane. And some of those stories are real nail biters. So I'm left with this one overriding principle that he taught me that I'll never forget, and I pass on to every student I have. Treat every patient like you would treat your grandmother. Let's all resolve to do just that. So tonight, let's lift our hearts and celebrate a great man, Dr. Michael K. Copass.
He was amazing. He could talk about literature, architecture, and the internal workings of a Porsche carburetor. He had the enthusiasm of a surgeon, and he had the wisdom of an internist. He was a guy who must have had a closet full of sleeveless sweaters and white shirts. This was a guy who implored his patients, when you call 911, sit down and let the medics get to you. Of course, this was the same guy that when he called the medics, he walked up his driveway to meet him at the street. Understand, Dr. C, we have to look at pre-hospital care and what it was in 1970 here in the Seattle metropolitan area. Boeing was laying off 37,000 employees a month. The Space Needle was hanging suicide nets, and somebody was supposed to turn the lights out in Seattle when they left. That was the environment that Medic One was born in. For me, I got to kind of simplify things, and I'm going to simplify it by saying that program was like building a passenger ship. The architect with all the vision was Dr. Cobb. And then there was a shipyard with skilled workers. That was Gordon F. Vickery, chief of the department. The owner of this program is really the taxpayers. The passengers on this wonderful ship are the patients, and the staff on this ship are the paramedics and doctors and nurses. The only thing we had missing in this wonderful ship was somebody who could run it. We needed a captain. Copass took the helm, and he guided us through many storms, some of which were the loss of federal funding, which became the birth of the Medic One Foundation. A mayor who wanted to give the program to a private ambulance company. A police chief who wanted it in the police department. Thank goodness that didn't happen. I love my brothers in blue. That was not a... Because if I get stopped on East Marginal, I want to make sure I don't get trashed. And a city council member who repeatedly said, let's charge for this service, even though the citizens of this community had voted an EMS levy. As Dr. Foy had said, Copass was there always for you personally or professionally. He made pre-hospital care in our community the very best in the world. He made politicians understand, physicians support, and administrators approve. But to know him was to accept his mantra. Always place the patient first. Show compassion and understanding to every patient, rich or poor. Always perform at your best, even when you are at a low point mentally and physically. Dr. C was the patron of paramedics, as he was in Alaska. But even saints need to refresh and renew. Dr. Copass was blessed with Lucy and a wonderful family. They may not have always liked his commitment to us, but they understood it. God bless Dr. Copass and his family. Thank you.
Dr. Copass was a man of vision and dedication whose impact on the world around him was profound and enduring. His reach was vast, as we've heard, and his support for Southeast Alaska EMS and rural hospitals was evident and was the inspiration behind the founding of Airlift. Driven by his own experience of being unable to transport 3 children out of Sitka, motivated him to work tirelessly for 2 years to ensure no other doctors in Southeast Alaska would have that experience. In that short amount of time, he started Airlift, and we've been working hard since then. Dr. Copass was the kind of person who surprised the crews by showing up on a scene, even in remote places like Port Angeles, just to make sure that the airway was secure and the team had what they needed. He had a vision that drove him, and I think we've heard it before, but he often said, if someone needs your help, you give him help. He believed in letting our work speak for itself, encouraging us to keep our heads down, do good work, and let that be what gets us noticed. He understood the immense demands he placed on us to ensure that the care people deserved was delivered to the highest standard and always available. Finally, I'd like to say Dr. Copass was more than a physician, and I think we've heard it from a couple others already. He was a mentor, a guide, a true visionary. His legacy lives on in each of us, in the work we do, and in the countless lives he's touched. We are forever grateful to have been part of this journey, and we are now obligated to carry that forward into the next generations.
And of course, the patients just adored him. Even given the years that have passed, an army of those patients, FOCs, Friends of Copass, they just can't stop but singing his praises and more importantly, holding us to his high standards. His clinic notes were engaging short stories. They weren't very widely appreciated until he started dictating them instead of handwriting them. And his handwriting was, as people are obviously knowing, was a bit curious, and there were really only a few that were able to decipher this descriptive sort of rolling kind of thing. I don't know whether it was some experiment in handwriting from the past.
Dr. C had 3 house rules. Work hard, be kind, treat every patient with respect. Oh, and always pick up the black phone in the radio room, because there's only one person who calls that phone, Dr. C, right? Any hour, day or night, pick it up. He just wants to give you some gentle feedback on your care that he just overheard. Does this man sleep? He fastidiously trained all of us, firefighters, paramedics, nurses, flight nurses, doctors, into a strongly rehearsed chain of survival. And for us physicians, his daily 6 a.m. sharp review of the charts of the prior 24 hours of patients in the emergency department was legendary and sometimes terrifying. Don't take it personally, I was born pissed off. Grinding his teeth, not even looking up. His red grease pencil feverishly writing his impressions of our care. And when that session was over, he bolted across the street to Medic 1, where he surely burned through another couple red grease pencils, and only then circled back to see his own neurology patients in the neurology clinic with Will. He was the doctor at Harborview most likely to be seen washing a patient's feet or clipping their toenails. He was obsessed with quality. He was filled with humanity. The respect that Dr. Copass had for people who would otherwise be classified as destitute was very real and very strong. He loved to treat them like VIPs, and he insisted that we do the same. He took the time to learn their backstories of their families, learn their aspirations. My upper spine was shattered, very unstable. My spinal cord had no room to wiggle. And there are many accounts of Dr. Copass flying up to bring me home to Harborview in an airlift Northwest Learjet with a halo screwed into my skull and a C-spine traction vest ratcheted up over 50 pounds, all of which still cause profound feelings in me. I just figured I would put on my Superboy sweater and go save Sam, he said to Molly Hogan. And in the words of our own Pam Turner, Dr. Copass was as proprietary of his team as he was of his patients. A few weeks ago, I uttered a "rest in peace, Dr. Copass" to Bob Cluse. And he turned to me and he said, "Are you kidding? Dr. Copass is the last person who is resting in peace. Rest in bruxism is more like it," referring to that teeth grinding as he reviewed our patient charts. So for many of us in this room, Dr. Copass, may you rest in bruxism. We could never thank you enough.
From day one, the influence of Dr. Copass became clear. He quickly established an expectation of care that is now shared widely throughout the EMS community. As an EMS provider, his values would resonate into our soul and become the fabric of who we are today. He understood and connected with each of us individually, creating trust and an environment of support. What we grew to fear most was not fear itself, but rather it was the potential to disappoint Dr. Copass. Dr. Copass was clear, concise, and consistent with his behavior, his communication, and his messaging. It wasn't accidental. It was an intent to build something bigger than himself and to model his expectations of us as providers. He was developing not only outstanding paramedics, but also mentors to educate, inspire, and recruit the future of EMS. You all have or will mentor the next generation of paramedics. You are and have set the stage for the future of EMS in King County and beyond. The message I share tonight is not just about the Copass era paramedics. It's inclusive of all the providers in this room. Physicians, nurses, and paramedics from Class 1 through Class 51. We are a team that has worked together daily for over 50 years to provide remarkable outcomes to the communities we serve. If you've walked the halls of Harborview, you are part of the Copass legacy. No matter the circumstance, he would say, treat every patient as though they're the president of the largest bank in the city, who might just be having a bad day. Dr. C also developed grit and determination in all of us. He expected us to work above our capabilities, get better every day, and never settle. These messages and more were all in an effort to ensure the trust of the communities that we serve. There was always an expectation of continued growth from Dr. C. Just know, we are who we are today because of what he taught us. And the hundreds of thousands of lives saved by the hands of the people in this room are because of the expectations that were set by Dr. Copass.
Donnie Chin was my big brother, and Dr. Copass was his mentor. In 1968, Donnie created what became the International District Emergency Center because police and fire were slow to respond to our neighborhood of mostly Asian immigrants. He was 13 years old. IDEC is an all-volunteer organization that provides services free of charge. Donnie would buy canned food with the little money he saved to pass out to elders when he saw them looking in dumpsters for food. As Donnie grew older, so did they. He knew they needed more than food, they needed health care. Donnie learned first aid, mostly self-taught. Dr. Copass was curious about the Chinese kid who'd hang around the Asian firefighters in Harborview Hospital. He could see that Donnie was compassionate and passionate about helping others. He believed in hard work. They became fast friends. We are all part of Dr. Copass's legacy. Donnie trained hundreds of volunteers and saved hundreds of lives. He mentored generations of kids in the ID. Those kids wanted to follow in Donnie's footsteps, so they became doctors, nurses, teachers, and counselors. Dr. Copass's unwavering dedication and commitment to excellence is unmatched. Dr. Copass and Donnie made the world a better place. They live on in all of us. We are so grateful that Dr. Copass saw something in the little kid from the ID. Sorry. I always picture Donnie in heaven greeting friends and family as they enter and passing out the new assignments for the day. But now I know that Dr. Copass is beside him, making sure it's being done correctly.
Gathered to honor the extraordinary life and legacy of Dr. Michael Copass, a man whose impact on emergency medical services cannot be overstated. Dr. Copass showed us how a medical director could inspire EMS clinicians and elevate community health through care on the streets. He didn't just participate in the formation of EMS, he helped build it. The subspecialty of EMS medicine stands on the foundation he laid. I speak for EMS physicians here and around the globe when I say that Michael Copass taught us what it means to be an EMS medical director, compelling us to aim higher, to strive to become the Michael Copass of our own communities. His passion and leadership shaped generations of EMS professionals. His work in founding Airlift Northwest provided critical medical resources, making a lasting difference in so many lives. He was a man who saw problems, no matter how large, and then he fixed them. He might close with, "This patient will be lucky to make it to Seattle, but you are his best shot. You got this." His words gave so many confidence to keep going in the toughest situations. A well-known flight nurse with Airlift shared some thoughts as well. He said Dr. Copass viewed every patient as a gold coin, someone whose life story gave us a chance to do better. It was a privilege he never took lightly, and that perspective shaped the careers of so many. Rick, I think, conveys our thoughts in his last quote. "I miss him, but I will carry his lessons and share them." Dr. Copass, thank you for everything. We will honor your legacy by continuing your work.
In the fall of 1977, I had just finished my training at the university, and my first assignment was the Emergency Trauma Center. Needless to say, I was impressively undertrained and unprepared for that assignment. Now, actually, Dr. Copass actually made that very clear to me the day I met him. He actually had little need for this junior varsity administrator. The only thing that he cared about is who can help me ensure that our team can deliver the best care to our patients. I learned very quickly that only action really mattered to Dr. Copass. I remember him asking him, how could I be better? And he said, "Mr. Rona, just come and spend 24 hours with us." And so I did. I witnessed the heroic efforts of the trauma teams. I remember the careful orchestration of everything by Dr. Copass. There was not a detail, as you've heard, there was not a detail that was missed. There was not a case that he did not review. If he thought you did a good job, you might get a nod or a small smile. If you thought you could have done better, you would know. I was always reminded by Dr. Copass of the critical importance of the end customer, the patient, and how anything else in between really did not matter. The term servant leader has been very popular in recent years. The leader is there to ensure that the team has what it needs so it can be successful easily in caring for the customer or for the patient. Dr. Copass was modeling servant leadership over 40 years before its time. Dr. Copass was also well known and beloved by those so often unseen. From saving people's lives to guarding their dignity, he lived compassionate leadership. And while there are and have been many stories about Dr. Copass and his intensity, they pale, indeed they virtually disappear when compared to the extraordinary impact he had on patients, on staff, on those he trained, and on emergency medicine.
Good evening. I'm Catherine Copass, Dr. Copass's third and, of course, favorite child. My mom, Lucy, Dad's wife of 61 years, has asked me to say thank you on her behalf and on behalf of our entire family, to the many people who have joined forces to plan and carry out this wonderful memorial. Our gratitude is to the Medic One Foundation, Airlift Northwest, UW Medicine, Seattle Fire Department, and to the many fire and emergency services personnel and associated unions from throughout the region who are represented here today. Thank you. And thank you to all of you who have come this evening to remember the life and contributions of our beloved dad, brother, grandfather, uncle, and husband. Gathered here are Dad's friends from his school days, his colleagues, patients, students, and friends of the family. We really appreciate hearing your stories about Dad and the impact he had on all of us. We acknowledge the quiet joy he found in the very personal connections he made with so many people he met throughout his life, so many of you in this room. And we will especially remember his tenacity, his unwillingness to give up on patients, on his colleagues, on his old cars, and on himself. And we used to joke about Airlift being a late in life fourth child, one that cried a lot in the night. But we know that voice will still get through to us, calling on us to be compassionate, to improve from our mistakes, and to be of service to each other and to our communities.
Dr. C gave us better patient care. He always stood up for the underdog. His compassion and care for his own patients and his humanity for patients everywhere was what everyone knew he stood for. No shortcuts in patient care, treatment, or rehab. Consider the personal stories you hear about disabled patients always giving him hugs. His putting warm blankets on patients' feet in the ER. The stories go on and on.
Some notes to summarize what I heard. We heard Dr. Copass was a Grateful Dead fan, a BMW mechanic, always there for people personally and professionally, a person who let the work speak for itself, didn't seek accolades, a mentor, a neurologist, known widely for his fine penmanship, a fan of gentle feedback, a provider of care regardless of somebody's station in life, a person who taught his students to play above their heads, a model of servant leadership decades before it was popular, and a master teacher who loved his red pen. We're going to miss him, but we embrace his mission of excellence because pursuit of excellence makes life better for our patients and those who serve with us, just like Dr. Copass did.
Portable 55, Airlift Comm Center. Portable 55, Airlift Comm Center. Launch tones for Portable 55. Dr. Michael Copass answered his final call on July 26, 2024. He was a visionary whose legacy will live on through the countless lives he saved, the air medical program he founded, and the world-class paramedic program he helped to create. His dedication to improving emergency medical care has left an enduring impact that will benefit generations to come. Dr. Copass was a legend whose spirit and contributions will never be forgotten. These are the final launch tones for Dr. Copass's radio call sign, Portable 55.